Welcome to Evergreen Family Medicine. Today we are with Psychiatric Nurse Practitioner Sue Ellis with Evergreen. Hi.
Hi.
Welcome.
Thank you so much.
Psychiatric Nurse Practitioner, PNP. What does that mean?
Well, actually, I'm a family nurse practitioner first with a DNP, a Doctor of Nurse Practice, which I practiced in family medicine for a few years, about 5 years, and then went back because the need was so huge for mental health. So I went back another 3 years like a crazy person, and so here I am, psychiatric. It's actually Psychiatric Mental Health Nurse Practitioner, so it's a PMHNP to confuse things even more.
Well, I understand you're a recent arrival here to Evergreen. So tell us that story.
My daughter married a young man who grew up in Oakland, and his father still lives there. So we've been coming up every summer for a couple years, fell in love with the place. And then after COVID and working at home for 2 years in isolation, a headhunter called and said, "Hey, how would you like to leave San Diego and move to beautiful Roseburg?" And I said, "I'll look into it." So I did. And I came up here and interviewed with the folks at Evergreen. And it was really what I was looking for, a community. So it's been really fun. I got here in January, so I'm a little new. But it's only been a few months. But so far, it's been very good. It's the collaborative environment I was looking for.
So what is your background as far as your education goes? Where are all the places you've been?
Oh, wow. So I started out as an RN, NICU, neonatal intensive care. Then I did some hospice. Then I realized that I needed to go back if I really wanted to practice medicine the way I wanted to practice. So went to the University of Arizona, where I got a master's in family practice. Then I went back an additional 3 years and did my doctorate. And I practiced a little bit in Arizona, came back home to California, and spent most of my time in a mobile medical unit treating immigrant farm workers and Afghanistan refugees and a teen clinic all at the same time. So my husband got relocated, so we moved back down to San Diego, where it was predominantly refugees and underserved. So I did that for probably 6 years, and then realized the big deficit in mental health. So I went back, and then I just worked primarily in San Diego for a couple of years, and till this opportunity came up. So now I'm here in Roseburg.
I'm sure that you could tell stories that would take the rest of whatever time somebody is spending in the lobby watching this right now. But I want to talk about the PNP part of your life now, that mental health side of things. So you said that you saw this deficit in support and help and providers in the mental health space.
Yes.
What was it that you saw, and what are you doing now in the space that you saw?
Was a huge lack of access. So people could go see their primary care, but always wasn't able to see a psychiatric nurse practitioner or even a psychiatrist, because there's just very few of us, to be quite honest. So family practice has done a great job at integrating and trying to meet the needs of this population. But what happens if somebody's severely sick, or the provider's not really sure, then a lot of times they go untreated. Or there is a dual diagnosis situation where there's a lot of substance abuse. And in that case, they fall through the cracks due to their own dual diagnosis, if you will, when you have a substance abuse diagnosis with coinciding with a mental health issue. So there's a lot of moving parts to it.
How is the conversation started between the patient who comes in for maybe a physical situation, and then it possibly pivots into a little bit more mental health? How do you bridge that gap?
Well, at Evergreen, they do an outstanding job in screening. So if you make an appointment to see your primary care, oftentimes they do what's called a PHQ-2, which is a basic screening about a mood. If you score positive, and it's basically 2 questions, then we move them to a PHQ-9, which really kind of speaks to depression, and then we have another one that speaks to anxiety. So the primary care providers actually are the ones that can filter that out. And that's where I often get most of my referrals.
Well, Sue, when we've talked about mental health here in the last couple of years, it's always been around COVID and the impact COVID has had on individuals and their mental health. We're kind of maybe getting out of that mode now, knock on wood. But what are you seeing in patients right now when it comes to their mental health as affected by COVID?
That's a really good point. I think that people have been allowed to isolate. And I don't mean allowed to isolate, but it's happened naturally with COVID. So people that were already somewhat social phobic or may have had some anxiety about being in public places, it's almost exacerbated it. And for kids, it's made it very difficult for them to transition back to school. And for grown-ups, I think that a lot of us were unable to get to the gym, maybe weren't eating mindfully. I've seen a ticking up of substance use. So it's kind of that time to get back. It's almost spring, and I hear that a lot from my patients. It's almost spring, I can go fishing again. So all the things that bring people joy, I think, have been put on the back burner. So I think we have to kind of take a holistic approach, look at our lifestyle, look at what we're not doing, what we are doing, and just kind of check in with yourself. If you feel that there might be a mood issue, come see me.
Well, thank you for your insight, and thank you for your time today.
Oh, you're welcome. My pleasure.
All right. That's Sue Ellis, PNP, Psychiatric Nurse Practitioner at Evergreen Family Medicine. You can see more about all the providers at Evergreen online at evergreenfamilymedicine.com, and you can follow us on Facebook, Twitter, Instagram, and YouTube.